Hey guys.
Hey guys.
Hey guys.
Hey guys.
Hey guys.
Hey guys.
Hi everyone.
I'm Billy Vega, and I'm part of the 2023 Future Docs program, and I'm an incoming freshman at UTC majoring in biology.
My name is Bahar, and I am a pre-professional biology major with a minor in chemistry. I'm currently a junior at the University of Tennessee at Chattanooga.
My name is Lawrence Bradford. I am a junior biology major at the University of Tennessee at Chattanooga.
My name is Anushka, and I am part of the 2023 Future Docs program. I am an upcoming freshman in college, and I will be studying pre-health society and policy.
I'm Julia with 2023 Future Docs program. I'm a rising senior at UDC. Majoring in biology. I'm taking a gap year after this, and I'll be applying to med school next cycle.
My name is Bailey, and I am a part of the 2023 Future Docs cohort. I am a senior majoring in psychology, minor in biology.
My name is Kamora Kirk. I am a junior at the University of Memphis, and I am a biology major.
Just got out of the Erlangers Hospital. I was with Dr. Ellis in ENT and also surgeon. We did a lot of tonsil removals. It's been so far a really fun adventure.
I just got off the internal medicine rotation for today. What I really liked about internal medicine was how diverse it was. There was so much diversity in the patient population we got to see. We got to go on many floors and see all different types of cases versus, when you specialize, you kind of see more of like a condensed patient population. So that was really nice to see. I had a great experience with the residents and the medical students. I met an internal medicine resident who gave me MCAT advice. I met a fourth-year medical student who goes to UT Medical School, and he told me with his experiences in taking the step 1 and the step 2 and some MCAT resources. The physician I met was amazing. He was kind enough to take me to the doctor's lounge, and he was so willing to answer any of my questions. He always explained the patients before we saw them, even if we already did a history. He wanted to make sure that I understood what was going on.
I've been shadowing anesthesia today, but we've been in and out of different patients' rooms, like before their surgery, so in pre-op. And that's been super cool, like being able to talk to them, in their most vulnerable moments. So I've really enjoyed that. It's been a very informative day.
I just got done at Vasculars, shadowing under Dr. Joels, and while I was with him today, he didn't have any cases. He was in clinic with the patients, like going room to room and talking to them and updating the charts and all that type of stuff. And I was just shadowing behind him. I just kind of listened to see how he would interact with the patients, how he talked to them, what he would say. It was not him just walking in and just like going in and asking the questions. He would like have a conversation with them first, which I thought was really nice. And so far, like at least today, the most interesting things I've seen so far has been he was taking out the sutures off someone's leg, and it was just really cool to see how the leg has been healing up and all that type of stuff. And I'm just excited to see how the rest of my day goes.
I shadowed plastic surgery. I got through about 3 surgeries, and it was a really good experience for me. Actually, I had a resident also with me. She walked me through all the procedures, through the surgery. She actually told me what they were doing and helped me to understand better. And after that, we actually took a walk and saw many patients, some patients that she will be doing surgeries on afterwards, and some patients that she had already done surgeries on before. So we talked to them. She walked me through the procedures that they had gone before.
And yesterday and today I've been with orthopedic surgery, yesterday in the OR and today in clinic. And so far I've seen 7 surgeries in 7 hours, and I've gotten to go in with the doctor and consult on some patients that are prospectives for surgery. I've gotten to see some follow-up visits post-op. One thing I really love about orthopedics is their efficiency without compromising their accuracy. Like I said, I've seen 7 surgeries in 7 hours, putting it at about an hour per surgery, whereas in some other specialties, I've seen about 2 to 3 in that same time period. One thing I found really cool about orthopedic surgery that a lot of other specialties might not have the luxury of doing is how orthopedics brought in like x-ray machines and CT machines in order to see what they were doing along the way as they were doing the surgery. I was with a hip and knee surgeon.
So I just currently wrapped up the second half of the day. I was shadowing with Dr. Pumelia, and he is a hospitalist. And with him, I was able to shadow a resident. Her name is Dr. Alyssa Farrell. And I was able to go in with her as she was speaking with patients. And so I think this particular part of the day kind of showed me, you know, how patient you have to be with certain patients, being understanding, being able to talk through with the patients, you know, about certain things that they may be experiencing with their bodies. And I guess overall just knowing the different types of medicines and how they may impact the body. And so I think this kind of just taught me that it's okay to make mistakes and it's okay to ask for help, because there's moments where you may second guess yourself and you might need that second opinion to help you out. And I just think it was just a moment to show how knowledgeable doctors and just healthcare workers can be, especially in their specialties.
Hey guys, my favorite part of this program was just seeing the team communicate, and honestly, today was probably one of the best days because of how funny the surgeons and the nurses were. They were all just laughing and having fun, which is definitely not something I was expecting from them, but it was really great. Something I wish I knew about, that other people knew about this program, was about how you don't have to be a physician you don't have to plan on wanting to be a physician or a medical student just to join this program. You can do whatever you want. The point of this program is to just get exposure. That's the best part of it.
My favorite part of this program was seeing how much of a variety of personalities there were in all the physicians I met. I found something that I really admired in every single physician that I shadowed across every single specialty that, in my opinion, made them a solid doctor and made them more enjoyable for the rest of the team to be around. And I saw the importance of truly being yourself as a physician and showing compassion in the way that you show it best, because I feel like all the physicians have embraced their personality and who they are, and they've done it in a very professional, kind, or funny way. And it was just really nice to see that and see how many different types of people actually are physicians and are in the medical field, and how there's genuinely space for everybody. Every single physician has something that makes them special and makes their care special. One thing I wish others knew about this program is how it completely changes your perspective on medicine. I mean, I would genuinely say that I fell in love with medicine again after going through this entire program. After kind of being on so many different services from like 8 to 5 for so many days in a row, I saw so many things that opened my eyes to so many new experiences. I literally have learned so much about every specialty, and I did not know how much there actually was to learn. It was like everywhere I looked, there was just so much knowledge to be learned. And that was just a great experience for me because I never want to stop learning. I think anybody who gets to do this program will come out feeling very grateful and is very lucky to have this experience.
I have had many favorite parts of this program. However, I would say one of my favorite parts has been just learning. I think that I am a big nerd at heart, and so learning everything that I've been able to learn has been such an invaluable experience. From, you know, learning about like the anatomy and physiology of the body, and then learning about patient care and how to make your patients feel more comfortable, and, you know, just being a good person as opposed to being a good physician. While I've learned both of those, I think that it's very important to be a good person, and many of the physicians that I've shadowed have shown me that. But one thing that I wish that others knew about this program would be the personal connections that you can really gain from just shadowing physicians that you're matched with. So obviously educational experiences are gained, and those are very invaluable, but I think that the personal experiences that you gain, the camaraderie that you feel by shadowing a physician is terrific. And I think that by being personable, being outgoing, you know, just being yourself, you are able to establish these connections and to gain contacts for shadowing in the future, which is very important, you know, as a pre-med as well as in medical school. So I think that this experience provides that, and I wholeheartedly recommend this experience to anyone who is considering it, anyone who is considering a future in medicine in any capacity. So I think that this program has helped me tremendously, and it is definitely one of my most valuable experiences this far.
My favorite thing about this program was that I got to get into the awards without even, before even I started the med school, so that I get an idea now if I want to do medicine or surgery. So that was a really cool experience for me. And one thing I wish that all of you know is that how cool and how friendly all the doctors are. So they're like so happy to share knowledge and so happy to explain everything to us. I felt that so nice and so warm. Like everybody's just trying to help you out. Like there are many residents and math students who are like in the 3rd year or 4th year and doing rotations over there, so that they're like literally giving you the numbers so that you can call us anytime or whatever you want help with. You know, they're just so friendly and so cool, so that like you can get help from them, and like it is so hard to find actually. So I really wish people know more about this.
Hey, now that the Future Doc program is coming to an end, I just want to talk about something I really enjoyed from this experience, and that was just being able to watch like doctors and physicians and nurses, just all of them interact with patients, with each other, in clinic, in the operating room. I just really enjoyed seeing such healthy communication, and it was not as serious as I thought it was going to be. It was happy. They were doing the best to keep each other uplifted, making sure the patients were helped, happy, comfortable, and just watching that just gave me so much hope about the situation and just made me realize what healthcare is really about. It's just wanting the best for your patients. And just know that if you're interested in joining this program, you don't need to know a lot about the practice, about healthcare. You just need to have a passion for it. I'm an upcoming freshman in college. I have very limited knowledge about healthcare, and I was really confused about some of the things that were going on. And everybody was so happy to help explain things to me. I didn't feel bad asking questions. I didn't feel like a bother. They made sure I knew that I was not a bother by asking these questions. And I came out of the experience knowing a lot more than I did before about each practice I was able to witness. I was able to shadow. And that's just something I feel like is really important for someone who doesn't exactly know what they want to do in healthcare. And I'm just really grateful for this experience.
So I think my favorite part about the Future Docs program has been getting to interact with not only the doctors and make connections with the doctors, but also getting to interact with and make connections with the medical students and the residents. With one of my rotations, I was on pediatric orthopedics, and my doctor had only had a half day seeing patients that day, and she was saying, I have a splinting lecture later. You're more than welcome to stay. If you don't want to stay, that's totally cool. But I ended up choosing to stay, and I got to do their little splinting clinic with them, learning how to splint an arm, or a splint to an elbow, I believe is what specifically we're doing. We're doing long arm splints, but that's not the point. Point is, I got to learn how to do it, and I got to actually interact with the med students, and they gave me really great tips on the MCAT and applications and stuff like that. All the medical students and stuff that I've met throughout this program have been really, really great, but it was especially fun getting to interact with them and getting to do skills with them and getting to see that they're still asking questions as 2nd and 3rd years, even if they've done the splinting clinic 2 or 3 times. Like, it's good to know that I don't have to be perfect, and that they understand that asking questions is the way to learn, and that they showed me that obviously asking questions is the best way to learn. But I appreciate all of their help, and I thank the Future Docs program for giving me the opportunity.
As the program is coming to a conclusion, I would like to take a moment to recap the program in its entirety. And so the first question that I was asked is, what is my favorite part of the program? And to be honest, I really can't pick a favorite part of the program, because honestly, being able to be a part of this program was such an amazing opportunity for me. Being able to shadow so many amazing physicians, doctors, surgeons, I honestly couldn't pick a favorite moment, because I was honestly just grateful to be able to be in the same space as them and being able to get a little bit of insight into their daily schedule, I guess, tasks for the week. And so I would like to take the moment to share a little bit of some of the things that I have seen. So I've seen different procedures, I've seen patient examinations, I've seen so much through this program, and honestly, it's all my favorite because maybe it's me being eager to learn more, but I just can't pick a favorite part of this program because honestly, I love the whole program. I appreciate this whole program for what it's done for me and the opportunities and the knowledge that I've been able to learn throughout this program. And so the next thing I was asked was one thing you wish others knew about this program. And honestly, I would say I wish that others knew, I guess, to be open-minded, because medicine, or what I've learned throughout this program, is that medicine is about constantly learning. And so I would say to just be open-minded, be willing to learn, be willing to listen when it comes to shadowing these different specialties with these different types of healthcare workers, because you can learn so much from this program. And I'm truly grateful that I was able to experience something like this. And I hope that whoever is watching this or to the next cohort, I hope you're able to enjoy the program just as much as I did and just as much as the others did. Thank you.